Hello, welcome to Fertile Minds. My name's Julie Buchanan and I'm an obstetrician, gynaecologist and fertility specialist with Queensland Fertility Group. It can often be confusing when you're going into pregnancy about knowing what is the right thing to do. So today I'm going to be speaking to you about the top 5 tips for a healthy pregnancy. Number 1, please take your prenatal vitamins. If you're not sure what they may be, you can see your GP or have a chat to a pharmacist. But probably the most important prenatal vitamin is folic acid, and this helps to prevent neural tube defects such as spina bifida. We like you to take 400 micrograms daily for at least 1 month before conceiving. There are other prenatal vitamins that we feel are good for you to take to help with things such as boosting the neurodevelopment of your baby, to also help with boosting your immunity and to prevent anemia. These things include taking iodine, iron, which is good to prevent anemia and is also good for increasing your stores during your pregnancy, and other vitamins and minerals that can be in combination within a multivitamin. Some of these prenatal vitamins will also help with reducing your levels of nausea and vomiting in the first trimester. However, if you do experience nausea and vomiting in the first trimester and you're finding it difficult to keep down your prenatal vitamin, please talk to your GP, midwife or obstetrician who may be able to give you advice on what other prenatal vitamins you can take. Tip number 2 is getting back to nature. I cannot stress this enough. Trying to conceive and then falling pregnant is such an exciting time, but if you've never done this before, there's lots of questions on where do I go next and what do I do? It can become quite stressful. It's important to take time out for yourself, get outside, exercise where you can, and just take time to breathe. I know this sounds a bit funny, but it's so important. Tip number 3 is maintaining a healthy weight, and I guess this relates a little bit to getting back to nature. Women who are underweight or overweight can experience difficulties and have riskier pregnancies in these situations. However, when you are pregnant, it's not the time to put on a lot of weight or to try and lose weight. This all needs to be in conjunction with your healthcare provider during your pregnancy. However, maintaining a stable weight in pregnancy can help to progress your pregnancy so that baby grows at an appropriate rate, and also helps to reduce your risks of things like miscarriage and preterm birth, as well as other risky developments such as gestational diabetes. Tip number 4 is education and support. We are so lucky now that there is so much information available with us, but at times it can be really overwhelming. Sometimes it's good to have one source of information, and that's usually your healthcare provider, such as your GP, midwife or obstetrician. The education that we really ask you to focus on are things like antenatal classes to prepare yourself for ongoing pregnancy and mode of delivery, as well as breastfeeding information, first aid classes for baby, and parenting classes, as in what to expect in the first few weeks after bringing your baby home. The other thing to be really mindful of is our mental health. So it is important to have a good relationship with your family and support people, as well as your healthcare providers. Where do you go to get all this information? There is so much online, which is great, but you need to be careful with what sort of information you look out for. And again, your healthcare providers can help you with this. But some examples include the Australian Breastfeeding Association, for mental health and anxiety and depression, Panda and the Gidget Foundation, and also asking your healthcare provider for other local knowledge such as parenting, sleeping, and lactation consultants. Tip number 5 is to cut out toxins such as alcohol, smoking and drugs. These can all be harmful for not only when you're trying to conceive, but also during your pregnancy. There is no known safe level of alcohol in pregnancy, and we strongly recommend that you either cut down or try not to drink alcohol while you're trying to conceive, and also when you're pregnant. There is something called fetal alcohol syndrome, which can affect babies, and there is no known level that we can advise women that will occur to their babies. Smoking can also affect the baby's growth and lead to other pregnancy complications such as miscarriage and preterm birth. Smoking can also have an effect on babies ongoing and can lead to diseases in children such as asthma. There is again no safe level of smoking. We strongly advise that you don't smoke. It can be hard to know what kind of chemicals and toxins can be dangerous to you and your baby during your pregnancy. It's best to avoid strong chemicals such as strong cleaning solutions and pesticides and herbicides, for example. Some women will ask, can I get my hair dyed? Can I have fake nails? Can I have a spray tan? Generally, you can. I would probably advise to avoid these in the first trimester and try to use natural products as much as possible. But generally, most of these beauty products are safe in pregnancy. Thank you for listening today. I hope my presentation has been helpful. Please feel free to subscribe to Fertile Minds for more information on fertility.